most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Our humble
Bob.
opinion. Today we're going to talk about how to finally stop your back pain. We're going to have you answer 10 questions.
10.
But, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section.
Right there.
We're always giving something away. This week, we're giving away a Bob and Brad product. I'll show you in just a minute.
That's right.
You can also go to Facebook. It'll be pinned to the top of the page.
That's
go
right here.
Twitter, Instagram, or TikTok if you want a 60-second version of our program.
And we now have podcasts out there with some outstanding
I'm just going to show our giveaway real quick here, Brad. So... All right, let's get started, Brad.
All right.
So these questions were developed by Stuart McGill. He is probably the world's foremost expert on back pain.
That's right.
And it's in his book. It's an excellent book. These questions were from his book called The Back Mechanic. I think it's the best book out there right now.
Sure.
So the most important thing you need to do when you're trying to get rid of back pain is you got to stop the cause. I mean,
stop the irritating component. Right.
A lot of people think like, oh, I hurt my back, it's going to stay hurt. That's not true.
Mm-hmm.
You've got something that's irritating you during the day. And if you stop those irritating things, the pain will calm down eventually. The nerves will calm down. Everything will calm down.
And you might think, I had a lot of patients say, what irritates it? And the first response is everything.
Everything. Exactly.
And then I talked to them some more, and finally we can figure out where the primary causes, or maybe two different causes.
Yeah, we start off this process by basically doing the questions, but we're going to do another video that's going to show you some tests you can do on your own to try to help narrow down what is the cause.
Right.
So you want to watch both of these videos, or all of our videos you want to watch. So number one question, does the pain change in intensity? That's usually, I like to see that it does. Like, there'll be times where maybe you have no pain or little pain, and then times where you have severe pain. That usually means you can control it then.
Sure.
I mean, if you can have pains where there's times where there's no pain, well, we're going to increase those.
Right.
So
trying to associate that with your activity then or just prior to that.
Yeah, try to make note.
Right.
It's not the worst thing to even have a logbook.
Yes.
Okay, when you roll in bed, do you feel any catches? This is a really good sign of instability in the spine. And I'm going to explain that one, Brad.
Right, because that might not be clear.
Yeah. So let's say you have a disc problem at one level. You have all these vertebrae that stack up to make your back. If you are unstable at just one level, when you move, all of the movement's going to occur at that one level instead of all spread out among the other levels.
Sure.
It's hard to explain this without showing it, and we don't have a good model to show it. So, but you just have to take our word for it. It's usually the sign of a disc problem, and it's a sign of instability in the back. And so what you're going to want to do is you're going to, when you try to get out of bed, you actually tighten your abdomen.
Right.
Like a corset.
Yep. Like you're putting a back belt on, you just tighten up those core muscles and really try and keep your whole trunk, we call it log rolling.
Right.
So it's everything's stabilized together by using those abdominal and back, or core muscles, we'll call it.
What a difference it makes. I've seen it with patients, like they were very skeptical, like they thought it's not going to make any difference, and they're like, wow, I got out of bed without pain.
Sure.
And that's the first step. Then you start realizing, hey, maybe I can control this pain. Maybe I do have control.
That's a big step, is feeling confident that you can deal with this.
Right, exactly. So this is probably the most obvious question. What makes your pain worse? I mean, you start writing down, like generally we find is that people are going to maybe have worse pain with bending forward, which is a really common way.
Yep.
Or maybe it's bending up straight and backward.
Yep.
Yeah,
Yes, sir. You're not even bending forward far. Sometimes it's just
just a
bending
little bit,
over
right?
a bench while you're doing something, perhaps at work or in the kitchen, and you don't even realize that you're bending forward, and a little bit can make a big
Why don't you show
difference.
twisting too, Brad? Just it might be with twisting,
Yep. So
just turning.
when you turn, especially
Yeah,
the low back pain, whoa,
yeah,
and just a little bit. So then we're going to talk about.
and maybe it might be in one direction.
You're
It
right.
might be mostly to the right, and
Yep.
when you go to the left, you're fine.
Yep. Over here, no problem. Oh, that way.
And of course, we got to throw in things like load and fatigue,
So
and
lifting,
right,
pushing, pulling heavier objects.
or some things you might be fine with until you've had it, you've done it for a long time. Like
Right.
you might be fine sitting for 10 minutes,
Yep.
but at 15 minutes, it starts to hurt.
Right.
You don't go to 15 minutes then. You have to stop at 10 minutes
Right.
and do something else in between.
Right.
So there's ways around this. We brought this one into any history of osteoporosis, osteopenia. The reason we ask that is it's very common with osteoporosis or osteopenia. By the way, in some ways, they're not that much different. People think osteopenia, they're fine.
Sure.
You could be a higher risk for fracture with osteopenia.
So we're talking about bone density loss.
Right.
Your bones are becoming weaker. Typically with older people, it's common.
Yeah. So the problem is there's about 300,000 patients who go to the doctor each year. It's estimated that another because of a fracture
In their spine?
In their spine,
Okay,
yeah,
compression fracture,
Yep.
whatever. Those are common.
yeah. The bones
Diagnosis.
squeeze together, but they estimate that another 600,000 don't go to the doctor and don't even know that they have a compression fracture.
Sure.
It's called the silent fractures, and it's very, very common. So if you have osteoporosis, you probably want to have that checked out. A bone density test, and also probably you might, if you're having pain, you should have an X-ray.
Of your spine.
Yeah, of your
Yep,
spine.
yep. Yeah, it's not a major fracture. It's something that has to be read oftentimes by a radiologist. The MD may not be able
Right.
to see it. You got to get an expert, which is very common. They
Yeah,
always do
they
that.
always do it anyway. So, number 5, any trauma involved. If there was trauma involved, like you're in a motor vehicle accident, or if you fell,
Yeah.
you should be seeing your medical provider just to make sure that no fractures occurred,
Right,
or
right.
nothing untoward happened.
Sure.
So, all right, is your pain worst thing in the morning? If it is, this could be your sleeping posture.
Sure.
And quite often that's what we point to. If you're sleeping in a good position, and you're moving a little bit, you really shouldn't have increased pain at night. You know what I mean? Unless you irritate it during the day and
Right.
fired
right.
it up. But
Yeah.
so,
Well, yeah, and we have videos on how to readjust your body or use some supports to help eliminate that night pain.
exactly, you might be putting pressure on that back all night long. If you have, for example, if you have kind of a large buttock
Mhm.
and you sleep on your back, the back is going into flexion all night long.
Right.
So,
Or sideline.
or sideline. If
Right.
you're a little wider hips, you could have your back sagging all
Yep.
night long. So,
Or wide shoulders.
right,
Mhm.
right, absolutely. So, all right, does your pain worsen throughout the day? This usually indicates that you're putting your back into some poor positions. I mean,
Sure.
something, or maybe too much load. I mean, maybe you're fine at a lighter load, but as soon as you start putting some stresses on the back,
Right.
it can't handle it.
So if you have to move boxes throughout the day and the lighter ones are, you're doing fine, and and that's kind of a common sense one, I think. A
Yeah.
lot of people, but just when you say load, I just wanted to clarify that.
Well, I think, Brad, what we're trying to hammer home here is that, something is causing your pain,
Mhm.
and look for it. And if you can't find it, you aren't looking hard enough. I mean, really. I mean,
Right. And that we're making, it's one of those things. As a therapist, we're trained and we have this experience, and
Right.
a lot of times it's just sitting, you feel fine. But that sitting, long-term sitting with poor posture, kind of sneaks up on you, and it feels fine until you get up, and then it's like,
oh, right.
oh, what was that? What did I do? And it was
Yeah.
actually the seated posture that
Eh,
you're completely unaware of.
Or it might be you're seated in a perfectly fine position, but you sit too long.
Yeah.
I mean, there's length of time too. So
Yeah.
you should get up and walk.
Right.
So,
Which can be a problem depending on your job.
right.
Yeah.
Well,
So,
usually you can walk to the bathroom anyway,
right.
so, all right. Is your back pain more concentrated in the middle back? This is for people, a lot of people, Brad, they've developed poor positioning and movement patterns where they actually tend to, instead of bending at their hips and keeping their
Mhm.
back straight, they
Right.
bend at the mid back.
Yeah.
They call it a
Roundhouse.
hinging, right where the ribs meet the low back.
Right.
Yeah,
So below the
so-
shoulder blades, but above the low back. It's
Right.
right in the middle there.
but
kind of.
they get into this movement pattern of going like this,
Yeah.
and that's almost always causing the mid back pain.
And that's one of those things you're certainly, almost certainly not aware of.
Right.
It's a habit that's been going on for years or developed. And so that is one of,
Yeah,
like a lot of these things, you're just not aware of what you're doing. With
yeah.
your
I
body.
think back to a couple of patients I had who had mid back pain, and they had to lean over a fence to do something. And I'm like,
Sure.
I knew right away what they were doing. They were doing that.
Yep.
They
Yep.
were bending at the mid back
Right.
and hinging, and you want all the movement to occur at the hips, not the mid back.
Right.
So, all right. Does your pain also radiate into your box and feet? If it goes all the way down
Yep.
into your feet, it's more likely a disc
Yeah.
problem.
If it's past the knee down here,
yeah,
disc. If it's to the knee, then there's a
Yeah,
could be
question mark.
SI. It's still a back thing, but then it's a little bit more challenging to figure
yeah.
out.
So, you're getting a pinched nerve somewhere. It could be piriformis too, but somehow you're getting that nerve pinched, and you're
Right.
definitely going to see the doctor in this case.
Right.
So, does your pain increase with fast walking or does it decrease?
Hmm.
Usually, if it decreases with fast walking, it's often a disc problem because a disc problem will increase when you're walking slow. It just puts a little more load on the spine.
Stuart McGill,
Yeah.
he talks about
Yeah.
that as well.
But then, what case does it increase, Brad, when you're walking? That would be a spinal stenosis, and that's such
Right.
a common thing that they call it shopping cart syndrome. Like you lean
Right.
on a shopping cart and it feels better. And if you have spinal stenosis, you maybe only walk 100 yards and you have to sit down and give yourself relief.
And then when you sit, it feels good,
Better, right?
typically right away. And that's more with the older population.
Yes, exactly.
60 and over. It's not an
Yeah.
uncommon diagnosis to have, but it's certainly nothing to get too excited about. There's some exercises that can help you out.
Yeah, and you deal with it too. You like you manage it like Brad manages his spondy. I
Right.
mean, you
And-
you figure things out, and Brad runs and bikes and swims and
Right.
And-
I just got to be careful.
irritates people. So he does all those things.
I don't bike too far, Bob, or
Yeah.
it's still
Right.
uncomfortable getting off the bike. And
You don't let
I
it
know
bite
that.
too far.
Right.
Yeah.
Yep.
Exactly.
You learn your limitations.
Yeah, and that's the whole, again, the summary of this video is let's find out what's bothering you.
Mm.
Let's calm it down. Let's not let it irritate you and can flare up to the point where you can't do anything.
Right. So you need to either modify the irritant, maybe use a back support, change your body mechanics,
Yeah.
or if you can avoid doing that activity, which can be challenging, but
Yeah.
often sometimes it's amazing where
You may have to avoid it for a while, but then
Mm.
we can eventually get you back into it maybe with modifications.
Sure, yep.
So, all right. Remember, Brad and I can fix just about anything
except
a
for
broken heart.
right.
And I think I've been working on it harder than Brad. to be honest
Well,
with
that's true. I kind of,
you. I hate to be catty about
what's a guy going to do about it?
it.
Sometimes you got to take a break from the old heart thing.
All right. Thanks.